Mr. Chairman, I move to strike the last word. This is just incredible to me. First of all, I agree that we need to deal with the crisis of children and adolescents committing suicide. And fortunately, we do in this legislation. But the attack on women's health is absolutely unacceptable. During a global pandemic in which millions of people are seeking family planning and other critical reproductive health care, we should be increasing support for Title X. The Title X program disproportionately serves communities of color and low-income communities, and a failure to act will actually severely hurt these communities disproportionately, and we should not be doing that. And most Americans, I think 99% of women for sure, support access to family planning. And quite frankly, it happens to be a pro-choice nation as well, where most Americans, not all certainly, think that abortion should be safe and legal. But this isn't about abortion. It's about contraception. And the fact that there would be an attack on contraception is not even, I can't even understand it. It was already said that more than 40% of women report that because of the COVID-19 pandemic, they changed their plans about when to have children or how many children that they want. 1 in 3 women, 33%, report that because of the pandemic, they had delayed or canceled a visit to a healthcare provider for sexual reproductive health care, or had trouble getting access to contraception. There are sharp disparities here. Women of color and low-income women are much more likely to state they want to have fewer children or delay having children, and are more likely to report problems accessing this care and this contraceptive availability than their white and higher income people. These providers and patients need funding now. Without any kind of supplemental funding, then trusted family planning providers may have to close their doors altogether, leaving women without access to these critical services. I mean, Title X is the nation's family planning program, supporting excellent care for 50 years. And it is just an outrage that this amendment would seek to take away that right of women to make decisions about their own reproduction, whether they have children or don't have children. And it should not be posed against our help for children and adolescents who are committing suicide. These are two separate issues that require our attention, and that's why we are doing both in this legislation. And I just think that this should not be considered as a fair exchange, but that both are priorities, and we can do that. The richest country in the world can provide family planning and take care of our children. Actually, those two things are related. Taking care of children, having control of how many children that are born in this world can also affect how children grow up. So I absolutely encourage my colleagues to vote no on this family planning program, Title X, which is a blessing to Americans, and I yield back.